How do antiviral drugs target the flu virus in children? When a child gets the flu, it can be a real challenge to manage. But did you know that specific medicines called antiviral drugs can help fight the virus? These drugs don't just mask symptoms. They actually interfere with how the flu virus reproduces and spreads inside the body. Understanding how they work can help parents and caregivers know when to seek medical help and how these medicines can make a difference. Most antiviral drugs used for children are called neuraminidase inhibitors. Examples include oseltamivir, which is taken as a pill or liquid, zanamivir, which is inhaled, and baloxavir, approved for children 5 years and older. These medications work by blocking an enzyme called neuraminidase, which the flu virus needs to release new virus particles from infected cells. When this enzyme is blocked, the virus cannot spread to healthy cells as easily. This means the infection stays more localized, and the child's illness may be less severe. Timing is important with these drugs. For the best results, they should be given within the first 48 hours after symptoms start. Early treatment can shorten how long the child feels sick, reduce the chances of ear infections or pneumonia, and even lower the risk of hospitalization. This is especially important for children under 5, those with chronic health issues, or those who are very young, such as infants under 2 years old. Older antivirals like amantadine and ramantadine were once used to treat flu, but they mainly target influenza viruses and are no longer recommended for children because of resistance and side effects. They work by blocking a protein called the M2 ion channel, which is necessary for the virus to uncoat and begin replication inside the cell. But because they are less effective now, they are rarely used. There are also newer drugs like favipiravir that inhibit the virus's RNA polymerase, an enzyme needed for copying the virus's genetic material. These are less common in children and are usually reserved for severe or resistant cases. Doctors carefully decide whether antiviral drugs are right for each child. They consider the child's age, health status, and how severe the illness is. These medicines come in different forms suitable for children, including liquids, pills, inhalers, and sometimes intravenous forms for very sick children. Using antivirals can help children recover faster, reduce the chance of secondary infections, and prevent serious complications. However, they only work against the flu virus and are not effective against other illnesses with similar symptoms. Supportive care like rest, fluids, and fever reducers is also important. Parents should watch for signs that need urgent medical attention, especially in very young children, those with underlying health conditions, or if symptoms worsen or last longer than usual. Always consult a healthcare professional to determine if antiviral treatment is appropriate. When used correctly and early, these drugs are safe and can make a real difference in managing the flu in children. Remember, vaccination remains the best way to prevent the flu, but if your child does get sick, antiviral medications can be a helpful part of the treatment plan.